Hello and welcome, I'm Tafarag Damo. The Ebola pandemic is still around, but what are African governments doing about it? Is the response prompt and adequate? My guest today, Ambassador Febe Potgieter is the advisor to the AU Commission Chairperson Lamine Zuma. A very warm welcome to the program.
Thank you very much.
Are we caught by surprise?
I think we were. The disease has been in existence in the
1976?
Since 1976, but there's always been localized, or it's possible to contain it, very low deaths. So the form that it took in West Africa and those countries in particular caught everybody by surprise.
And this is unlike we have seen before.
It's completely unlike what we've seen before. If you look at the cases just taking on the continent, in the DRC, in Uganda, in Southern Sudan, it's always been very localized, as I said, and very relatively small number of people that were infected. I think that the spread of the disease, there's obviously been specific circumstances in the three countries, just emerging from conflict, very fragile health systems, so that their responses, and it's also 3,000 kilometers away from where it started before. So unlike other countries that had those systems in place, one, and secondly, experience of the disease, they were not able to respond quickly, and therefore the disease spread much quicker than what would have been the case if it was in Uganda or in the DRC.
Why couldn't they respond quickly? I know some of the reasons, but perhaps it's a fear factor to blame here, you think?
No, I don't think that's the main reason. I think the main reason has got to do with the fact that lack of experience of the disease amongst medical workers and the health system. And this is the important issue about developing African systems of monitoring disease, and the African Disease Control Center, which was proposed by Ethiopia at the January summit, is so important, because disease knows no borders, as we've seen in the case of this. But if there's a system of being able to share information, to quickly respond to circumstances, if a country has never come across a disease, they can then speak to other countries that may have experience and be able to respond appropriately much quicker. The second one is that I think that the issues about the fear factor played a role. Even in how, as other African countries, we responded to the crisis, it also was a fear factor. I mean, closing borders was one way that we responded. People stopped flights. There are systems in place that ships that dock in those countries can't dock elsewhere, which means that they can't get their exports out, they can't get imports in. So I think that the response to the disease, yes, it's been driven by fear, but I think it's also been the lack of experience, and this is linked back to your earlier question, that were we taken by surprise. I think that everybody was taken by surprise. For example, in April this year, the African Ministers of Health met in Luanda with the World Health Organizations and to look at the issues.
A month after the outbreak was...
Yeah, that's right. And at the time, it was the standards that were in place was to say that, okay, we've had it in Uganda, and therefore we request the Ministry of Health from Uganda, DRC, and not just to a lesser extent Southern Sudan, but those two countries, to send experts to the countries, which they did. But even they haven't encountered the disease on the scale and the level that it happened in those countries. I mean, that was in April. Only on the 9th of August did the World Health Organization declare a public health emergency, and 10 days later the African Union Peace and Security Council said that since this is a public health emergency, we need to deploy a special mission to Liberia and to the three countries, and on the 15th of September our first health workers went out in the field.
Well, why did it take so long, you know?
I don't know, it's a question that we should ask.
I mean, the African Union, it took what? March, April, May, June, July, August, 6 months.
I think that one of the things that we throughout the period we were engaging with the World Health Organization and working our ministries, the ECOWAS ministers, to say that monitors the situation. I think that we were waiting for word from the World Health Organization in terms of what exactly is the likely trajectory of the pandemic. And therefore, once they declared it as a public health emergency, it was then possible for us to jump into action. But I think that as I say, that by August, very little was known about how the disease is going to develop. We now know much more.
But we know that there was no vaccines, as we know today. We know that people were dying. We know that we cannot control this unless we make some immediate intervention and so on and so forth.
Right.
That's why I asked this question.
Yes. I think that you're absolutely right. And if you look at the responses from the countries, they mobilize workers, and particularly the International Committee of the Red Cross, the National Red Cross Society, quite early on mobilize local volunteers to deal with the deaths. There was responses in terms of at a national level through the health system, but that obviously wasn't enough. And I think that as the chairperson has often said, that all of us were too slow. I think that we should have reacted much earlier. That as an international community, as an African community, as the regions, we should have responded much earlier. But it's with the wisdom of hindsight.
Were these international organizations about to forget it before it started claiming so many lives? For example, the US, they refused to realize the magnitude of the problem until it hit home.
One of the reasons why the African Union in August took this decision to deploy the humanitarian missions, because we're used to deploying peacekeeping missions. We're not used to playing humanitarian missions. First time that we've done it, so we're learning as we proceeding. One, but also secondly, the work that we've done to mobilize our member states to put forward volunteers, but also the work that we do to mobilize the private sector, citizens to be part of it. Because yes, the international community has a responsibility, but as Africans we also need to take charge of our own destiny. And this is a problem that face 3 countries in our continent, and therefore we need to pledge solidarity with them and help them to come to terms with it.
What exactly have we done from this side, from the continent side? I mean,
what we've done right at the beginning since April is to get those countries that have expertise in the disease to deploy experts there. So Uganda, the DRC in the main, to help sit with the ministries of health and look at what needs to be done in terms of their national health system. In addition to that, the deployment of volunteers. If you look at also what our member states have contributed, a number of them have contributed monetary through Nigeria, Botswana, Namibia, South Africa, Algeria. A number of countries have contributed different amounts, but they have contributed towards that. Some countries have contributed in kind, sending laboratories there that's staffed by their people. So they've made those kind of contributions. One of the things that we also learned this week, that the private sector, the African private sector, also have done their bit. For example, one of the issues that were raised quite strongly by some of the banks operating in those 3 countries and other companies, that their decision is, and even the mines, that they will keep their open for business. They're not going to close because it will have devastating impacts on if livelihoods are lost, if jobs are lost, revenue is lost. So that's also part of the contribution that companies on the continent are giving towards making sure that the disease do not have the kind of impact on those countries, in addition to directly contributing to stopping it.
You earlier talked about the fragile health system in the 3 countries. They have to create new health facilities and so on and so forth. Is that what happened?
It's complicated. Yeah, it's not complicated. But what has happened is that you're right, fragile health systems. So the response from the international community have been that you don't have enough treatment centres. So what they've done is to build treatment centre. A lot of them are fairly temporary structures, but they're there, so you've got more beds than you had a month ago. And over the next 2 weeks, it's probably going to double the amount of beds that's available for treatment. What we need now is personnel that's going to staff those beds.
You're talking about public health workers, health workers?
Yes. Public health workers, doctors, nurses, lab technicians, epidemiologists that will be able to go out and do the contact tracing and work with local community health workers to follow up on what's happening with people that have been in contact with those infected. It's all of that, and the approach of the African Union is that we need to move faster. And that's what we said to all the international communities, including to our member states, and as a union, what we need to do. But in addition to that, we also need to do it in a way that help build capacity in those countries. For example, in the next round of deployment, part of what we need to do is to look at we're training thousands and thousands of public health workers to be able to explain to people what Ebola is about, how do you avoid it, how do you prevent it, as well as the treatment and getting people to treatment centers. Now that's a core of people that you can use for other public health functions, to deal with malaria, to deal with maternal mortality, with other forms of diseases that those countries have. So not to just focus on Ebola, but also to use that as a nucleus of a rebuilding of a public health system. And I think that the same should happen with the treatment facilities that's being built as well. That we shouldn't build facilities that once the disease are over, then they're back to square one where they were at the start of the disease in terms of the health facilities in those countries. And we need to look at how do we spend our money properly, that we do leave a legacy behind.
So is it working? I know that you've visited those countries recently.
I think
what is here on the ground?
At the point, we've been there about it's about nearly 2 weeks ago. And I think that there's a sense that we're turning the corner. We know much more now than we did 2 months ago about how to control infection, how to do contact tracing, what needs to happen with regards to the protections and protocols for medical workers. Secondly, there's much more facilities now in place. There is a system of deployment of additional health workers. So I think that if you look at the latest figures that came out over the last week or so, it seems as if we're reaching a plateau with the numbers of infection. The challenge in the next couple of weeks is to make sure that we get that down. And that is really what the push of the next couple of weeks is about for us, to make sure that we've reached that plateau. And yes, it's good. We need to begin to see drop in infections. But also with more treatment centers coming online, it also means that you have even people that are infected, that there's more people that actually survive the disease.
What are the challenges that you see as you try to address those problems?
Sure, I think that one of them is of course the money to do those deployments, to get the health workers there, and that is why the African Union in the second round of deployments have focused on calling on governments, because the expectation is that governments will, if they give 20 or 100 health workers, will keep them on salary for the 3 months that they spend in those countries. That what the African Union will raise resources for is their additional allowance for their accommodation and transport and all of the logistics involved working with UNMIA. And then, so it means that the cost per worker goes down, and we can deploy much more people than we could during the first round of volunteers.
But then there are issues that are very much, challenging. I'd guess, like for example, contact tracing.
Yeah.
People are dying, and there's safety burial issue.
I think that there's the Red Cross, International Committee of the Red Cross, have seen that as their area of specialization. So they've got national committees. They've brought in international expertise, because the Committee of the Red Cross have worked in humanitarian situations elsewhere. So if you have a big earthquake, you've got to deal with bodies in order to prevent diseases from breaking out. You've got to deal with it quickly, otherwise it has other impacts. So they've got the expertise on that. They've got local volunteers mobilized and teams. Those workers now have the protective clothing to be able to deal with it. So I think that on the question about once we, and the World Health Organization have set the target, once we're able to safely bury 70% and over of the disease and people that have been infected, that we will then see a much more drastic decline. So the push is on making sure that that aspect of the disease management is taken care of, and the International Committee of the Red Cross and the National Red Cross committees are doing an excellent job there. They need support, but they're really out there on the forefront. We need to do the issues around treatment, and that is why we're sending in health workers, doctors, nurses from member states. We need to look at the contact tracing, and hence the focus on epidemiologists as well as lab technicians, and working with local health volunteers. So part of it is to look at all of these different streams, and then of course public education. One of the interesting things that having travelled to the 3 countries over the last 2 weeks ago, is the extent to which there's an awareness about it. You get off the plane and you immediately get checked for your temperature. You wash your hands 3 times through the period that you go through there. That any building that you enter, there's facilities to wash your hands. It's in a community. So there's quite a bit of awareness around that. It obviously needs to be expanding. And in our discussions with the private sector, your cell phone companies, Coca-Cola and others, they have the opportunity to use their infrastructure to also help governments to get that public health messages across. But there's quite a fair degree of awareness about it, and we need to do more. We need to do more to make sure that people report to the treatment centres, that there's proper approaches towards the burial of diseased people, and then also dealing with the social impacts of the disease. One of what we also find is that when parents die, the normal in all African communities is that families take over the children, but because of the fear factor of infection, people don't want to take in the children. So you sit with lots of orphans that have nowhere to go. And part of the responses that the governments of those 3 countries now have to look at is how do you create facilities for these orphans, and they're using people that have recovered because their infection rate is much lower, to be able to look after orphans in the context of this social trauma that these 3 countries face. So there's also the economic dimension of it. The UN Economic Commission for Africa is doing a study, and it's nearly towards its end. They're expecting towards the end of November to have the results out, of looking at what really is the impact on the economy of these countries. What's the impact on agriculture? What has been the impact on cross-border trade? What has been the impact on shipping? On all of the different sectors. Because, for example, when we were talking to the finance minister in Sierra Leone, growth for the first 6 months of the year is still at 12%, but they're expecting by second half of the year it will be down to about 5%. Next year, if things don't turn around, it may go down much lower. But the loss in revenue, about $90 million US, it can get more over if we don't get this under control. So it's both a social and a public health issue, but it's also an economic issue. And hence the need for a focus to a push to make sure that we get this under control.
Africa is considered just one country, right? I mean, the perception from the West. And you can see that tourism being seriously affected in several countries in the continent. Because if you go to Africa, you're going to catch Ebola. So you better stay out of it.
That's right. You're absolutely right. That's been the case, that there's this perception, and the narrative about the continent is that even though it's on the GDP that those 3 countries present, even population is less than 1% of the continent, there's this perception that it's affecting the whole of Africa. And yes, it affects us because it's our brothers and sisters in those countries. But Africa still is the fastest growing continent in the world. I mean, even if you look at the figures for this year, Ethiopia is growing well, Kenya, a number of other countries. Yes, there are sectors that have been affected, and the tourism sector in particular. But in general, we're quite confident that the trajectory for growth is still moving in the right direction. One part of the reason for also making sure that we had this roundtable this weekend with business, African business and businesses doing business on the continent, is to engage with them around those narratives, to say that you have ArcelorMittal has a plant in one of those 3 countries, and it's still open for business. It's operating. It may have been operating at a reduced capacity, but it hasn't laid off any workers. It doesn't have any plans to pull out of the country. So it's open for business. Coca-Cola is still operating there. The cell phone companies, MTN, Vodacom, Safaricom, all of them are still operating in those countries and in the rest of the continent. But it is about shifting those narratives, and at the end of the day, it's also about Africans shifting the narrative about what comes out of our continent, and therefore it's important to talk to our business leaders who are. They have a global footprint.
And you have raised at this Africa Business Roundtable you just mentioned, you have raised quite a substantial amount of money, right? Or is it not?
Well, it depends on what you define as substantial. But we think we're quite happy with the final figure. The message that we went to, that the chairperson of the African Union Commission, Dr. Dlamini Zuma, went to this meeting was firstly that this is a continental problem and that we all need to make our contribution, that governments are prepared to pay for the salaries of health workers for the period that they will be deployed. And therefore, we need to look at how do we raise additional resources to be able to deploy those workers. So therefore, we need the cash, we need the competencies of business, we need the logistics frameworks, etc. And they were quite willing to come towards the party. And what we call the initial at the end of the day on Saturday, the pledges was about in excess of 20 million. The African Development pledged an additional 10 million US dollars. So it's about 30 million US dollars that was raised on the one day. In addition to that, there were also quite a number of businesses that said that we thought that we're going to give something, but we don't think, after we heard the plans of the African Union, we didn't think that that would be enough. So we want to give us the opportunity, a couple of days, to go back to our boards and say that they must up their game. So the 20 million plus the 10 from the ADB is the initial wave. There's companies that were not there that's saying that we want to contribute, and so we think that it's the beginning of a process.
Is the West doing enough along that line? Because there is so much criticism coming.
Well, the companies that we spoke to are both Western companies, African companies, because that's our main constituency, but also Western companies and companies from across the world, India, China, Japan, that do business on the continent. And that's why we reach out to both groups, because they make their money on the continent, so therefore they have a stake in making sure that this is brought under control. I think that our focus is that, specifically for the African Union, that we need to make sure that we mobilize Africans. And we had a very interesting contribution from the Ethiopian business delegation that was there. They said, no, we can't do a pledge today. We come as umbrella organizations of Ethiopian business, but we're going to have a meeting and we will then discuss and mobilize from amongst Ethiopian business people and give you the amount. Similarly, business people for other sectors are coming together to look at how do they make a contribution. I think that our approach towards this is that if African business shows confidence in their continent, then the rest will follow. And if we don't have confidence in our continent, then we can't expect others to have that confidence.
Well, Madam Ambassador, thank you very much for your time. It was a pleasure having you on my show. Thank you very much indeed.